Now we want to shift gears and we want to tell you about a program called Compassionate Companion. Right now we are joined by the Executive Director, Carla Carlisle, who is with us today. And Carla Carlisle the program is a violence prevention program, and it is helping so many people in the community, but unfortunately the program is facing budget cuts. First of all, thank you for being with us.
Thank you for having me.
Tell us about your program.
Sure. Since 2024, we've served about 2,500 residents of Mecklenburg County, from young children to families and teens. We focus on mental health support and violence prevention.
And why is the program so important?
It's important because we've seen such a spike in youth suicide across the nation, but specifically in Mecklenburg County and in North Carolina. It's the second leading cause of death for youth ages 10 to 18. And we know that stigma still plays a big part in people avoiding mental health challenges.
And so obviously this program is very important, and it definitely makes a huge impact here in the city of Charlotte. This
Yes.
week you went before Mecklenburg County and you talked to officials there about funding for your program because you have already faced funding cuts, federal cuts. What was your message to officials this week?
My message to the county commissioners was simply this, that we either take time to address mental health and violence prevention on the front end, or we'll deal with it on the back end. We'll either see violence increase and mental health challenges increase in our communities, or with the appropriate funding, we can continue our work, which involves my organization, but many others, and it impacts all the zip codes across Mecklenburg County, across Charlotte, and all families have some level of impact.
And when you think about that and just the impact that your program is having on the community, losing that money could mean what for your program?
Well, it could mean a significant decrease in services to people in the community. Also, personally, it would mean an impact to my family as well. I would just say, because, my son has dealt with mental health challenges, and I have been very open about my own dealings with anxiety and depression, I know that I needed help. I needed a hand at times, and support and services. And so through the county, through the Department of Public Health, my program, as well as many others, are able to provide that support and services and train clinicians and peer support specialists to help others in the community.
And you've been vocal about your son's journey. Everyone doesn't know your son's journey.
Sure.
Can you talk about that?
Sure. My son came into my life as a foster child. I had him for the first 6 months, and then he was given back to his birth mother. I ended up letting my license go, my foster license expire, and I co-parented with them for 6 years. During those 6 years, my son started having some mental health challenges, and it culminated at age 6 when my son tried to die by suicide. And that's when I got emergency custody of him, and I eventually adopted him. That has been the biggest blessing for me, and my way of paying it forward and working in my passion is to help others.
And so when you think about your son's story, someone who tried to commit suicide, and you think about resources, and there's such a strong need for these resources, talk about the importance of Mecklenburg County officials funding programs like this so that we don't have suicides, so that we're not running into the amount of violence that we are seeing in this community.
Yes. One of the challenges that I see and that I experienced was that there are resources around, but nobody knows how to access them. One of the things that the Department of Public Health, Office of Violence Prevention, was able to do was corral those resources and provide them to the community. And so from my son's perspective, I had to fight so hard to get him services and support. And now parents don't have to take that same journey. Parents are able to go to the Department of Public Health, get resources through them, and we've seen licensed clinicians getting trained in trauma-informed therapy, and there have just been a multitude of trainings and support needed in the community, ranging from substance use disorder to violence prevention to mental health support. And so my ultimate concern is that we may see an increase in violence, whether as victims or as perpetrators. We may see more challenges in terms of the ability to get access to mental health support.
And just this week, I covered a story about a 16-year-old who was killed. And when you think about stuff like that, and then we hear so oftentimes, I spoke with someone else who does similar work that you do, and she says they really run into issues with, they might have one therapist per 50 children. And again, we're talking about a 16-year-old who was killed. A fight led up to that shooting. What are your thoughts about that?
Well, one of the things that I see is that through the county's work, through the Department of Public Health, I've seen clinicians get trained to be able to provide just that kind of support. Even if it's not through the school system, are now lists of therapists who have been trained as trauma-focused cognitive behavioral therapists, as alternatives for families and cognitive behavioral therapy. That's what my family needed, and we continue to leverage those resources. I don't want to see us lack therapists. I'd like to see more therapists be trained in the way that can be really supportive to families in this community.
And when we think about the Office of Violence Prevention, they're already down workers.
Yes.
What is your biggest fear if folks do not get the resources they need?
Well, if they don't get the resources they need, not only will they lose 2 more staff members, though they will be down to 2 staff members, and so that impact is already great. I have lists and lists of trainings, about 10,000 people who have been trained through the Office of Violence Prevention and the Department of Public Health. What I fear is that we will see a decrease in services and more people will go without the support. And one of the things that I really want to call out here is that when you have a child that tried to lose their life to suicide, you don't care about stigma. So I share that message with people, not to share all of our business, but to say that our lives are precious. And because of that, we need to put stigma to the side and learn how to support each other. And what I have seen and experienced through the Department of Public Health is that we've been very successful with that through my program and through many others.
And speaking of that, because suicide is real, mental health services are real.
Yes.
They're so needed in our community. And when you think about your program, talk about the impact your program is having. Give us an example of something that really stands out to you where you know your program was making a difference.
Sure. We've had one parent even say to us, "This workshop helped me realize I have tools to manage my stress and support my kids." I've had a young lady say to me, "I know that I'm not broken. My trauma stays with me, but now I have tools to really deal with it." That's what wakes me up in the morning. That's what keeps me going. I'm able to live and work in my passion, but I see real progress with individuals and families who have been touched by this work.
What is next for your program, especially if you don't get the money you need?
We'll continue to do some work, but it will be reduced in the community. I will continue to seek out funding, whether it be through the county or otherwise, and I'll continue writing books. I just submitted my 5th book to my publisher, and I'm going to continue to focus on challenging things like intergenerational trauma, youth suicide prevention, and we're going to continue fighting the fight, but we certainly can do more in the community with funding for Department of Public Health.
And earlier this week, you were telling me about a woman in your program. Can you
Yes.
share her personal story?
Yes, I met a young lady through Hill Charlotte when they had their hotel, and she was experiencing homelessness. She was unhoused, and she's a mom with children, and one of her adult children was just diagnosed with catatonic schizophrenia. She was dealing with so much and was just trying to get her feet back underneath her. She ended up having a cleaning business, and I was able to use her personally. And from that, and as I learned more about her story and I saw and experienced her resilience, I brought her on as a facilitator on my team, and she's now working with me in places like the high schools and Mecklenburg County Detention Center, sharing her story of resilience and really healing through helping others.
Wow, just a huge impact. So
Very
clearly
much.
your program, it means so much to people.
Yes.
Can you also talk on the other side, giving people advice, because you mentioned your son
Yes.
almost died by suicide, but
Yes.
there's so many people out there. I cannot tell you how many people I talked to in a year who have talked about possibly taking their lives.
Yes.
What would your advice be to them or anyone dealing with mental health challenges?
Well, first, I would say you're not alone. 1 in 5 of us are dealing with some kind of mental health challenge at any given time. I'd also say take advantage of the services that are available to you, whether it be calling 988, which offers free support, reaching out to a trusted friend or mentor, and just recognizing that suicide is a permanent solution to a temporary problem, and life can get better. I am a living example of that, and I would just lead with this, or I'd leave you with this. I believe in hope and I believe in healing. And I think reaching out to someone who really cares is so important. And if you don't have that, reach out to 988 or someone else, a professional who can support you, because you deserve to be here.
That is great advice. Any final thoughts, any closing remarks?
I just want to thank you for having me and just say, I've really tried to make such a big impact in this community, and I'm here to fight the good fight, and there are many others who are there with me, and we're going to continue to push forward.
Carla Carlisle, we really appreciate your time. Thank you for being with us and hoping that your organization continues to get the funding that it needs so that you can continue to thrive. Thank you again for being with us.
Thank you.
We will be right back after the break.